According to the Missouri Department of Health and Senior Services Influenza Surveillance Report, the overall influenza activity in Missouri is low. According to the report, the season-to-date number of cases of influenza is over 1,500 cases in Missouri. Dr. Laura Morris, a family medicine physician at MU Healthcare, says although the number of cases in the state remain low, they are seeing an uptick in patients with respiratory illnesses such as RSV, influenza, and COVID.
We have always had COVID, and we continue to see COVID cases, and so that is circulating in the community, and has been since the summer. Cases did settle down a little bit, but we're still seeing COVID, and we continue and plan that we will continue to see COVID cases.
Morris says it's hard to tell the difference among the typical respiratory illnesses. She says people experiencing COVID often have symptoms such as headaches, fever, and sore throat, and will often progress to more typical respiratory illnesses with secretion, runny noses, and coughing. She says while there is no antiviral treatment available for RSV or your common cold, Morris says they do have antiviral medications for COVID and influenza, which she says is very beneficial for high-risk patients such as infants and senior citizens. MU Healthcare does offer vaccines, however, for influenza and COVID for those 6 months and older. She says vaccines are recommended for all age groups, especially those at high risk.
And vaccines can help keep you out of the hospital, and they can shorten the duration of your illness. They can also make it less likely that you're going to be as sick and as contagious for as long, so you can get back to things like work and school safely and more quickly, and you're less likely to spread the disease to other folks in your family.
Morris says while some may be hesitant to visit the doctor's office, she says testing can be beneficial to help avoid further complications and identify illnesses that have treatment available. And while washing your hands and staying home while you're sick can help prevent the spread of these illnesses, Morris says the best way to prevent the spread and keep yourself healthy is to get up-to-date vaccinations.
First and foremost, one of the best ways to help prevent yourself from getting sick is to get vaccinated. So flu and COVID shots are widely available and effective. It does take a week or two for those to kick in. So now is the perfect time to make sure you're going to be covered for the rest of the holiday season and the rest of this winter and respiratory season. In Missouri and the Midwest, we see these viruses persist all the way through March and even into April or May sometimes.
Reporting in Columbia, Ryan Smith, KRCG 13.